In this video, you will learn about hospice and what the Medicare hospice benefit covers. If Medicare is not your primary insurance, then you or someone from your medical team should contact your insurance company to find out exactly what your hospice benefit covers. Most private insurance hospice coverage is similar to coverage provided by Medicare. Hospice is a medical service that focuses on providing only comfort to the patient and their loved ones during the final phase of life. Hospice care focuses on comfort and symptom control rather than cure. The goal of hospice is for the patient to feel as good as they possibly can feel during their remaining period of time, while accepting that death is a natural part of life. Hospice improves the quality of life by treating symptoms such as pain that may be causing suffering. The hospice team includes a nurse, social worker, chaplain, medical director, home health aides, and volunteers, all working together to help the patient achieve the best possible quality of life during this final phase. To determine if a patient is eligible for hospice care, doctors will look at the period of time remaining in the person's life. If doctors believe the patient is entering the final 6 months of life, they may be eligible for hospice care. Patients with dementia, cancer, or failure of any organs such as the kidneys or liver may be eligible for hospice if the doctors believe that the time remaining may be less than 6 months. It's important to understand that it doesn't matter what the diagnosis is. What's important is the amount of time remaining. If you have any questions about eligibility for hospice, you should ask the doctor. With the help of the hospice team, hospice care may be provided in a variety of settings, including in a private home. The Medicare hospice benefit will pay for any medical equipment, such as a hospital bed, bedside toilet, or oxygen if needed. It will also pay for medications that provide comfort to the patient. The hospice benefit will also pay for a home health aide to help with personal care, such as dressing and bathing. Most hospice agencies will provide an aide approximately 3 to 5 hours a day, 5 days a week. However, Medicare's hospice benefit will not pay for an aide to stay with the patient 24 hours a day, 7 days a week. When hospice care is provided in a private home, the hospice nurse and members of the hospice team will make home visits to provide supportive care to both the patient and their loved ones. If the patient has symptoms that are difficult to control and needs nursing care throughout the day and night, hospice may be provided in a hospital setting. Hospice may also be provided in a skilled nursing facility or long-term care facility in the community. If there are any symptoms to manage, the room and meals may be paid for by hospice. However, if the patient is comfortable and requires less care, the Medicare hospice benefit will not pay for the room and meals in a healthcare facility. The patient may also have to pay for some of the other expenses. We recommend that you discuss exactly what hospice covers with the social worker or member of the medical team. A nurse or a social worker will come to the patient's home for the first visit to assess the patient's needs. A nurse will lead the care team, which is comprised of your physician, social worker, volunteers, aides, and a chaplain if one is requested. The nurse will make arrangements for the delivery of the necessary equipment and supplies, and any medications needed to manage the patient's symptoms. During the first visit, the nurse will discuss with the patient and the family or caregiver the frequency of future visits. The nurse will also provide you with a number to call in case assistance is needed during the evenings or overnight. All hospices have a nurse on call available to answer questions by phone or to come to the home if a visit is needed in addition to the ones already planned. The nurse will work with the hospice team and your family to keep the patient comfortable as his or her symptoms change. The nurse will also communicate with your physician as needed. As part of the hospice program, support services are available to the family as well as to the patient. Your social worker can discuss the available support services with you and your family. The volunteer members of the hospice team can also be very helpful. They can stay with the patient while family members do errands, or they can be available to support the patient in a variety of ways, sharing music, listening, reading out loud, or just being there. You or your family member should discuss the hospice option with your healthcare provider. If that is not possible, you can call your local hospice provider and ask them to help arrange services with your physician. Some patients and families like to have a visit from the hospice team member to learn about the program, but then delay using the hospice benefit until they are ready for it.